Good morning. Good morning, everybody. The summer of New York City continues. It is going to be an unforgettable summer for a lot of reasons. There are so many things happening this summer that have never happened before that are going to be once-in-a-lifetime opportunities. Here's something that's never happened before. Restaurant Week is not just 1 week, it's 5 weeks now. It's extraordinary. The greatest restaurants in the world, an opportunity for you and me to go out there and experience them. Even if you don't got a lot of money, great deals for this Restaurant Week. And all those restaurants that we love, that we're really, fascinated by, that make this city so great, here's your chance to try some of the ones you haven't yet. Now, we know the restaurant community went through so much during the pandemic, but people fought back. These restaurant owners, the employees, they fought back, they kept the businesses going. And now Restaurant Week is going to give them more customers, a whole lot more energy. This is going to be amazing. Over 500 restaurants that are participating across the 5 boroughs, and that includes takeout and delivery options in a lot of cases. Reservations open now. If you want to find out where these great restaurants are that are participating, go to nycgo.com/Restaurant Week. And there's great examples of restaurants that are participating, including some amazing restaurants now at the Seaport here in Manhattan, new restaurants that are making that area even more exciting, including Carne Mare and Malibu Farm and Cobble & Company. And there's another great restaurant there called The Fulton, which I am looking forward to going to very much. It is a new restaurant from one of the greatest chefs in the world, Jean-Georges Vongerichten. And Jean-Georges is renowned because he has created in this city and around the world something extraordinary, something that people look forward to. People travel from all over to experience one of his restaurants. He is a New York City success story. He came here with almost nothing in his pocket. Classic immigrant success story. Came here in 1986. Now operates 39 restaurants around the world, including 11 here in New York City. He is a New York City hero, and he is with us today to talk about Restaurant Week. My great pleasure to introduce Jean-Georges.
Good morning, Mayor de Blasio. Thank you so much for supporting us here for Restaurant Week. I'm here to kick off Restaurant Week at the Union Market because good food starts with good ingredients. So here we are. Now we're very happy to start kicking off Restaurant Week at the Seaport District, the Fulton, Malibu Farm, Cobble & Co, Mama Fuko, Carne Mare, and everything at the Seaport. It's wonderful to be part of this, and thank you so much, Mayor de Blasio, for really helping the restaurant the last 18 months. Outdoor, indoor, terraces, it's amazing.
Thank you. Jean-Georges, let me ask you, you're there with beautiful fresh food that's going to your restaurants. Tell us about the Fulton, the newest restaurant in your empire. Tell us about the Fulton and what that is going to be like.
The Fulton is the first place. When I arrived in New York in 1986, I went to the fish market, which was the tin building and the seaport. So that was it's really my heart because it's a seafood restaurant next to the Fulton Bridge. It's absolutely wonderful. We know New York City is a world-class dining destination because of the diverse culture, taps, and food is a culture that brings people together. So we're very happy to be the kickoff of the Restaurant Week.
Thank you so much, and I want to just commend you. You have done so much for New York City. Your restaurants have been amazing, part of what makes New York City great. Tourists come here from all over just to experience the magic of what you have created. So, like so many great New Yorkers, you came here and you made this place better. And I want to thank you for that on behalf of all New Yorkers. And thank you for being a part of Restaurant Week, because a lot of people are just waiting to experience what you and your team have created, and this will be the moment. Thank you so much, Jean-Georges.
Thank you, Mayor de Blasio. This is wonderful. A great celebration of New York, on the comeback of New York. Thank you.
Amen. Thank you. The comeback of New York City. Exactly right. the summer of New York City, a recovery for all of us. This is what it's all about. Now, we know our recovery, of course, means bringing back our economy, bringing back our jobs, bringing back the tourists. Restaurant Week's going to help us do all those things. But we also know recovery requires public safety. Recovery will help us achieve more public safety. But to achieve the recovery, we need to keep working on public safety all the time. Saturday evening, I stood shoulder to shoulder in the Bronx with violence interrupters, with community activists and leaders, with Eric Adams, with Vanessa Gibson, leaders who believe in the power of grassroots solutions to violence. We were all united, and with a message filled with passion. We have to stop the violence, and we're going to have to do it from the ground up. We absolutely need and value the work of the NYPD, but we also need communities to come forward in the fight against violence, and no one does that better than the violence interrupters and so many grassroots organizations that are part of the solution. Look, President Biden has put forward a very bold plan in this area, and he actually modeled it on a lot of what we're doing in New York City. Policing and community-based solutions to violence. We need both. So this is what we're going to do to protect our children in particular. And when we were up in the Bronx, we all talked about the children. There were beautiful children there, gathered round, and everyone had the same feeling. We have to protect these children, protect their future. So I want to thank all of the organizations that joined us, all the violence interrupters. Their work is crucial to our vision, Safe Summer NYC. This vision begins with these community-based solutions to violence, doubling the Cure Violence workforce this summer, a huge investment in recreation activities, positive cultural activities for young people, giving them positive options. That whole piece is crucial. Of course, when it comes to policing, neighborhood policing and precision policing, which worked and has worked for years and years and is working again. And then the last piece of the plan, getting our courts back, and we made a lot of progress. We still need help from the state to get them to 100% full strength, because that's been the missing link. Do those things and the situation changes. So this is what we see time and time again. The work of the Cure Violence movement and the crisis management system, the violence interrupters, in the precincts where they are active, shootings continue to go down. It's such important work. To be clear, everyone, this is hard work. What the violence interrupters do takes a lot of bravery. It is work that a lot of times stops something before it ever happens. And it doesn't show up in a statistic. This is something, and we were there together on Saturday night. Eric Adams said, I agree with him 100%. It's the many times the violence that was stopped, the lives that were saved, the shooting that never happened. You will not see that as a statistic, but you will know the violence interrupters achieved that. So we've doubled that workforce. We're going to continue to deepen that effort. And we know that with the community, we can turn the tide. Someone who has been a leader championing the investments in the Cure Violence movement, a leader in bringing police and community together. She's a member of the City Council. She served as public safety chair for a number of years, and she is about to be the next borough president of the Bronx. My pleasure to introduce Councilmember Vanessa Gibson.
Thank you so much, Mr. Mayor. Good morning. It's really a great honor to be with you today. And I want to thank you and your team, Eric Cumberbatch, the Mayor's Office to Prevent Gun Violence, for joining us on last Saturday in our Claremont district. Last Thursday, we had a 25-year-old fatally shot who left behind two children, a 3-year-old and a 3-month-old. This violence is out of control. We are living in a state of emergency, and we need crisis intervention. We need alternatives to incarceration, safe spaces for young people and young adults. We need to give them access and opportunity so they don't feel the need to engage in violence and pick up a gun in the first place. We have the answer. We are the solution. And I'm grateful that our partners are joining us in the Bronx. I also want to thank Eric Adams for his leadership and commitment to joining us in the Bronx, because we know that no matter where violence happens across the city of New York, we are all in this together. The City Council has worked expeditiously, dedicating our time to make sure that our budget is reflective of the values and the priorities that we know New Yorkers care about: safe streets, Summer Youth Employment Program, 75,000 young adults that are working this summer. The all year round Work, Learn, Grow program, our Compass and Sonic and Beacon and Cornerstone programs. And I'm especially proud of Saturday Night Lights, a $5 million initiative that started July 10th that opens 100 school gymnasiums across the city of New York, Saturday night from 5 p.m. to 9 p.m. We need to make sure our parents know about these programs, they know about these community centers, but we know that it's not enough. Until we deal with the national crisis of gun violence with comprehensive gun control legislation at the federal level, the proliferation of guns in our communities, we will continue this vicious cycle. But as a local government, we can do more and we will step up. Crisis management system, the CMS organizations have been phenomenal, and I am thankful for each and every one of you. So Guns Down, Life Up, SOS Save Our Streets, RTG Release the Grip, BRAG, Bronx Rising Against Gun Violence, SUV Standing Up to Violence. We thank you for everything you have done. As the mayor said, you are saving lives and we don't even see that work, but we know you're out there. Continue to be mentors to our young people and give them jobs and hope and opportunity so they know they are the next generation of leaders. That is what we are tasked to do. That is our assignment, and we are going to do this work every single day because our children deserve to live in safe spaces, and this city must be safe for every New Yorker, regardless of zip code and where you live. Thank you, Mayor de Blasio. Thank you to everyone for your incredible commitment, and I look forward to working with you in the remainder of my time as your council member on behalf of District 16 in the Bronx. Thank you so much.
Thank you very, very much, council member. Thank you for shouting out the groups that do this amazing work. We stood with them on Saturday night. What heroes, and they deserve the praise. They deserve the appreciation. Thank you, and thank you also for your praise for Saturday Night Lights. 100 gyms open up around the city on Saturday nights. What a difference that's going to make for our kids. Thank you for your support and for being there every step of the way. Now, everyone, when it comes to helping our kids, we know that our kids went through so much in COVID. We know it's been a traumatic experience, an incredibly challenging experience for so many kids. We know we want to bring them back in every way. We have a plan to close the COVID achievement gap in our schools. We have a plan to do mental health screening for every child when they come back in September. We're gonna have to support our children like never before. And we decided to start right now with Summer Rising. Unprecedented, the largest summer program in the history of New York City. 200,000 kids right now, right this moment, enjoying a safe, positive space, academic support, recreation, cultural activities. It's been outstanding. I've talked to parents, and you're going to hear from a parent in a moment, about just how magical it's been to know that this is now a universal right. That if you need a place for your child this summer, there's a place for free in your neighborhood, available, positive, safe. It's making a huge difference, and it's going to help kids get ready for the fall and be ready to come back to school stronger. 200,000 kids are benefiting right now, and I want everyone to know it's an all-day initiative from 8 a.m. to 6 p.m. 8 a.m. to 6 p.m. Any child who needs this opportunity can still get it, and it is 100% free. But Summer Rising, now underway for the last couple of weeks. We are now getting close to the deadline. So I want to make sure all New Yorkers know, all parents know, if you have not yet chosen Summer Rising and you want it for your child, you have until midnight tomorrow night, Tuesday, July 20, midnight is the deadline. It's easy to sign up. We welcome as many kids as want to be a part of it. You can go to nyc.gov/summerrising. I saw the energy of Summer Rising the first day at PS6 in Flatbush, Brooklyn. It was beautiful. I helped to kick off the festivities, of course, with the Cha-Cha slide. Very, very important. Everyone, when you have something to celebrate, I mean, you, of course, have to bring the Cha-Cha slide into it. But let me tell you, the kids were loving it. The teachers, the parents, everyone was so happy to have everyone back together. A lot of kids had not been in school for a long, long time. So it's a great warm-up to get kids ready for the fall. Now, I want you to hear from a parent. She is a mom of 4, and I admire any mom of 4. That takes real work. She is from Staten Island. She does great work as well in her professional life to help others so she can tell you how important this initiative is to support our kids. My pleasure to introduce Liza Schatzman. I'm sorry, Liza Schatzman.
Okay.
My apology, Liza.
It's okay. Thank you so much, Mayor de Blasio. Good morning, everyone. I am beyond thrilled to be here today to talk to you about the Summer Rising program. I am a full-time working mom of 4. My husband works full-time as well, so when this program came out, I literally called it the working parent's dream. But in all honesty, it is a parent's dream and also a kid's dream. As Mayor de Blasio said, I have 4 children, 3 of which are in elementary school, 1 going into middle, actually. Lily, Ethan, and Ross. And they are so happy to have some sense of normalcy back now, to be able to go to school 5 days a week. The Summer Rising program is actually at their normal school, so they get to see their teachers. My son Ethan has an individualized education plan, so he gets to see his teacher, Mrs. Balsamo, who's wonderful. He gets to see her now during the summer, and they get to share his progress now. My daughter Lily talks to me all the time about, I made a new friend today from a different school, Mommy. It's wonderful. She's so happy to be there. And my son Ross, who just finished 5th grade, now feels ready for middle school. He actually tells me, now I know how to do fractions. Now I know how to do decimals. Like, he's ready. And I am beyond thankful for that. I would like to thank the mayor and everyone involved from the bottom of this working mom's heart for this program. It really has bridged the gap that's needed for kids. I can't encourage parents, New York City parents, enough. Again, the program is free. I have 4 kids, so normally I would pay for camp. My husband and I would pay for camp, and I can't begin to tell you the financial burden that is. So we are thankful for this program. I encourage every New York City parent to look into it. It closes tomorrow. The initiative, closes tomorrow at midnight, so don't delay. Sign up for the program. Thank you so much.
Liza, thank you so much. First of all, you are a superhero. 4 kids, and you and your husband each work full-time.
Yes, correct.
That is commitment.
Thank you.
Okay, thank you for everything you do. And I love what you said, the working parent's dream. I love that. I love that. And I will tell you, Liza, when we, way back when, started thinking about pre-K originally, it was because for Charlene and I, trying to find a pre-K opportunity for our child and knowing how limited they were and the stress that went with it alone was part of what motivated us to believe this should be something universal. That led to pre-K, that led to 3K. Summer Rising was not something we anticipated. And the pandemic opened our mind to the fact that we had to do something very different this summer. But to hear you talk about it makes me feel even more strongly that this is something we need to do in the future as well.
Agreed.
Because what you just said, a parent looking forward to the summer, you'd like to look forward to the summer, but I remember the same reality. Where is your child going to go? Are they going to get in? Can you afford it? Can you make the schedules work? And one of the things I've heard from Summer Rising parents is this 8 a.m. to 6 p.m. is actually something that connects with the real world of parent schedules.
Yes, not many programs do. So
Not many programs do, right. And so thank you for your impassioned testimony. And everyone, again, you've got till midnight tomorrow night, Tuesday the 20th, and anyone, a child who still wants to be in Summer Rising, we got you. Go to nyc.gov/summerrising and you can sign up. How much does it cost? It's free. Free. Okay, I wanted to clear that up. All right, now let's do a few more things. We're going to do our indicators, but first a vaccine update. And again, every single day, thousands and thousands of New Yorkers are getting vaccinated. We are closing in on 10 million doses. That's going to be a very, very important milestone for this city. So as of today, from the very beginning of the vaccination effort, 9,742,526 vaccination doses given. And this is why, as we go into indicators, even though we're seeing a challenge with the Delta variant, this is why we're holding the line, particularly on hospitalization rate. We do have a challenge now. We're going to be talking about it throughout the week. We're going to be talking about the indicators and how we're interpreting them, and some new information about the indicators ahead. But the bottom line is vaccination is the reason we're in a very, very different situation than other parts of the country that are suffering. I feel very bad for those places and those people. But New York City residents have stepped up as of today. 4.5 million fully vaccinated New Yorkers, that is 53.5% of our total population. 4.8 million New Yorkers who've gotten at least 1 dose, and again, we know overwhelmingly they'll be coming back for their 2nd dose. That's about 95% of all New Yorkers do come back for their second dose. But more importantly, immediately that first dose is giving some protection. That's 58.1% of all New Yorkers who now have gotten at least one dose, all residents, including kids, everyone. So this is really, really important. We got a lot of work to do, but this is the reason we have a strong foundation to work from. So today's indicators. Number one, daily number of people admitted to New York City hospitals for suspected COVID-19. Today's report, 92 patients. Confirmed positivity, 24.74%. Hospitalization rate, again, thank God, continues to be in a good place, 0.35 per 100,000. Now, number two, cases. We definitely are seeing cases going up. Again, we're going to talk about this throughout the week. The new reported cases on a 7-day average, today's report, 516 cases. And number three, percentage of people testing citywide positive for COVID-19 on a 7-day rolling average, today's report, 1.69%. Okay, let me just do a few words in Spanish, and I'm going to go back to summarizing just for a moment. Summarizing, está cambiando el sistema para las familias de toda la ciudad. Vamos a darles a nuestros niños el verano que se merecen, lleno de programas y educación de alta calidad. La inscripción finaliza mañana a la medianoche. Inscríbase hoy. All parents, one last chance to get into all the good things in Summer Rising. With that, let's turn to our colleagues in the media. Please let me know the name and outlet of each journalist.
We'll now begin our Q&A. As a reminder, we're also joined today by Health Commissioner Dr. Choksi. The first question today goes to Kala from PICS.
Hi, Mayor de Blasio. I hope you're doing well and enjoying your summer.
Indeed, it's the summer of New York City. Kala, how you doing?
Good, thanks. The U of T confirmed to me this morning that they're actually offering teachers $25 an hour to go door to door to talk with parents and kids face to face and get them back to the classroom, especially those kids who chose remote learning through most of last year. They told me that the DOE has their own programs. Besides Summer Rising, can you tell me what the DOE in the city is doing to outreach with these parents? Because, again, almost 60% of kids chose remote learning to end the year with last year.
Yes, and very fair question, Kala, but remember, let's do the quick facts. Parents chose that early on. In a lot of cases, they did not want to make a change. They got into a rhythm. They wanted to stick with it. But meanwhile, with every passing month, thankfully, things got safer and safer, better and better in our schools. You'll remember the last week of school, we gave you the testing numbers. There were almost no cases of COVID in our public schools. So parents saw that. They've seen all the other changes. They've seen that there's almost 10 million vaccination doses. But to your question, what we're going to do is keep bringing parents in. Chancellor Misha Ross-Porter has made very clear that we're going to have open houses for any parents who want to come in early, see the schools, talk to principals, talk to teachers, let them know that things are good and things are ready. We're going to do a lot of outreach, and we want to answer their questions. We also, one more point, want to focus on vaccinating kids 12 to 18, have maximum vaccination of those kids in the lead up to school. Go ahead, Kala.
I've also seen a letter from a principal saying if we stick to the 3 feet rule from the CDC, all students coming back to the classroom will not fit. So what is the plan? And when will parents hear a plan on what classrooms will look like?
Again, you know, we've spoken to this. First of all, that 3-foot rule is there now. We will make it work, period. We can make that work in our schools. I am not going to be surprised, as I've said many times, school's almost 2 months away, if the CDC changes or relaxes that guidance between now and the opening of school. So the bottom line to parents is to understand kids will be in classrooms that are safe with all those health and safety measures we've used previously. And again, Kala, it's good, it's right for people to ask a lot of questions, but sometimes it's also important to acknowledge the facts on the ground. We proved that our gold standard of health and safety measures worked. You saw it with your own eyes. We intensely limited COVID in our schools. We made our schools safe. We're going to be doing the exact same things again in an atmosphere where a huge number of people have now been vaccinated, a much, much better environment than what we had to deal with last year. So it will work. If the 3-foot rule is in effect, we can make it work with the 3-foot rule. But again, I would not be surprised if it's changed between now and then.
The next is David Rodriguez from Telemundo.
Hi, good morning, Mayor. Buenos dias.
Buenos dias.
My question today, buenos dias. My question today is, due to the challenge with Delta variant, do you expect or do you support any executive order to enforce mandatory mask wearing indoors and outdoors in New York City?
No. Simple answer, no. I'll speak to it, and I'll have Dr. Dave Choksi speak to it as well, David. Right now, we've got, again, 4.8 million New Yorkers who have had at least one vaccine dose. That number grows thousands and thousands of people every day. That's the ballgame. That's where we make the impact. The thing that actually stops COVID. Not the thing that, masks have value, unquestionably. But masks are not going at the root of the problem. Vaccination is. So we do not intend mask mandate. We do intend to double down on vaccination. We'll be speaking about this throughout the week and beyond, new approaches to vaccination, because this is where we make the difference. Dr. Choksi.
Thank you very much, Mr. Mayor, and thanks for this important question. Look, the Delta variant is concerning, as we've talked about, in previous days and weeks. It now makes up about 69% of the cases that we're sequencing. But our concern is primarily for people who remain unvaccinated, which is why the single most important thing that we can do to keep individuals as well as our communities, our cities safe, is to get as many people vaccinated as possible. I do also want to clarify that there are some settings where the mask mandate, particularly indoors, remains in effect. This includes public transit, it includes schools, and other high-risk settings like our congregate settings and in healthcare facilities. And in those places, we do want people to continue wearing their masks regardless of their vaccination status. But as the mayor has said, the key to our getting out of this pandemic is vaccination.
Thank you. Go ahead, David.
Question. I know that everyone is enjoying the summer here in New York City. So many people are waiting for maybe more details about the concert that should be happening in August. So do you have any more information about participants, about artists that will be joining this big concert? Thank you, gracias.
De nada. David, what I can tell you is this. We're going to have more information shortly, very shortly, hopefully a matter of days, about the lineup, the final lineup for the concert, and how people can get to be a part of it and see this amazing concert. You've heard some of the initial acts. They're amazing. There's a lot more coming. That's all I can say. It's going to be one of the most memorable concerts in the history of New York City. I don't have any fear of contradiction. It is going to be one of the most amazing concerts ever, and it's because all these artists want to celebrate New York City and want to be part of the comeback. So stay tuned. Much more to come, not just about the big concert in Central Park, but a lot of other key activities around the 5 boroughs for Homecoming Week. A lot more to be announced very soon.
The next is Chris Sommerfeld from the Daily News.
Hi, Mr. Mayor. How you doing?
Hey, Chris, how you doing?
I'm good. I wanted to circle back a little bit to the last question you were just asked about mask mandates. Councilmember Mark Levine, who was on your briefing last week, says he's planning to ask the Department of Health to reinstate indoor mask mandates, even for non-vaccinated individuals, because of this spike in infection rates. I understand you don't think it's inappropriate to reinstate a mask mandate, but what's your response to concerns from Councilmember Levine and others who agree with that point of view?
I think very highly of Councilmember Levine, and we've worked very closely together. I think he would say the same thing I'm about to say, but the ultimate voice is Dr. Dave Choksi, who you're going to hear in just a moment. And so, look, Mask mandates at a certain point before we had vaccination made a lot of sense. They still make sense, as Dr. Choksi said, in certain settings. And any private entity, of course, still has the right to decide what works for them. But Chris, I honestly think we would be doing a disservice if, instead of saying, let's address the actual problem, and we do believe there's other ways we can do that, we'll talk about it. Let's address the problem by getting more people vaccinated and going right at it and knocking down this variant. You know, a mask doesn't arrest the progress of the variant. Vaccination does. So we're going to go where the real impact is. That's the bottom line. Dr. Choksi, you want to add?
Yes, sir. Thank you. And look, let me just start with the reality that the more that COVID circulates, it is true that there's more risk for any given individual person. But as we've talked about before, that risk is highest for people who remain unvaccinated. This is why we need them in particular to continue following precautions. And it remains our strong advice for anyone who is unvaccinated to continue wearing masks, to continue physical distancing, and to get tested regularly. That remains just as important because even though we were recommending that several months ago, it is actually a more dangerous time right now to be unvaccinated, given how contagious the Delta variant is. Beyond that, as I said earlier, the mask mandates that are in places that are shared, indoor spaces like subways and buses and schools, particularly where there are a large number of unvaccinated people, that remains very important, and is a cornerstone of our approach. The final thing that I will say is that it is certainly reasonable for some people who are fully vaccinated, if they choose to continue wearing masks. This is more important indoors compared to outdoors. And there are, some specific reasons why it may be the case that someone who is fully vaccinated wants to continue wearing the mask and taking additional precautions. It could be that they're immunocompromised or otherwise, at higher risk of severe outcomes from COVID-19 illness. It may be that they're living with someone who is unvaccinated because they are not yet eligible to be vaccinated. And in those cases, we support the decision for individuals to continue wearing their mask. The bottom line is for us to get to the other side of the pandemic, what we have all been hoping for. The key to that remains vaccination.
Thank you. Go ahead, Chris.
Thank you. On another topic, opening arguments are starting today in Gwen Carr's lawsuit against you, Mr. Mayor, and the NYPD in the death of Eric Garner. Today's hearing is focused on which witnesses are appropriate to call. I was wondering, do you think it would be appropriate for you to be called as a witness, and would you be willing to testify if called?
Again, because it's a litigation matter, Chris, I'm not going to go into any detail. Law department should really handle that question. We're talking about a very painful moment in our city's history and for the Garner family. We've done a lot to try to change things profoundly since then, and I'm really looking forward to us being able to move forward, learn the powerful lessons, and act on them. I think we did, particularly with the retraining of the entire police force in de-escalation efforts. There's always more to do. But we're very, very committed to constantly making change and reform in policing. That's where my focus is going to be.
The next is Chloe Lee from Gothamist.
Hi, good morning. How are you?
Good, Chloe. How you been?
I'm good. One moment. So the question I have is just in terms of related to Councilmember Levine's statement. New York now ranks in the top 10 among states in terms of the growth of COVID cases, specifically that the case rate is up to 167% in past 2 weeks. Do you just have any comments on that trend, and do you think that maybe Governor Cuomo could be doing more related to that? That's it.
Thank you very much, Chloe. Look, and again, I'll turn to Dr. Choksi. The bottom line is vaccination is the answer. I think we've got a very substantial number of people who are willing to be vaccinated, who we've got to reach in different ways. we also have people that just need to hear a very forceful message about how important it is. Why you are literally, you're making people safer, your own family, your own community, you get vaccinated. And if you don't get vaccinated, you're actually running a risk for yourself and your family. And we've got to make that plainer than ever before. That is the solution. And it's, Chloe, it's a little eerie that we have a solution. You know, there's so many things in society where we have a problem we don't know a solution for. We actually have a solution. It's right here. It's available. It's free. Anywhere you turn, you can get vaccinated. We've got to use every tool in the tool case to get everyone vaccinated. To me, that is the ultimate solution here. Dr. Choksi, you want to add?
Thank you, sir, and thank you, Chloe, for this question. To answer it, yes, I am concerned about the increase in cases that we're seeing in New York City that appears to be propelled by the Delta variant, as we've mentioned. But as the mayor has said, so much of the suffering that is associated with COVID-19, particularly the severe outcomes, needing oxygen, having to visit the hospital, being in intensive care and requiring a breathing tube, and of course the worst outcome, the death of people whom we are close to, whom we love, all of these are more avoidable than they have ever been during this pandemic because of vaccination. And so what we have to do is ensure that every single person who is eligible for the vaccine not just has the opportunity to get vaccinated, but is strongly encouraged to take that step. That's how we are going to minimize the suffering that we have all been borne witness to through too much over the last 18 months. And that's what we can do together as a city.
Thank you. Chloe, did you have a follow-up?
No, I'm all good. Thank you.
Okay, thank you.
The next is Nolan from The Post.
Hey, good morning, everybody.
Hey, Nolan, how you been?
I'm all right, Mr. Mayor. How are you?
Good, good.
You keep talking about the importance of getting people vaccinated and that you believe the more people who get vaccinated and the more familiar people become with it, the more willing everyone will be to do so. It's hard to think of a group of people who would be more familiar with the vaccination and what it means than staffers at city hospitals, nearly 1/3 of whom remain unvaccinated. So is it time for a vaccine mandate, at the very least, for hospital workers?
No, and look, it's obviously a fair question. We're continuing in dialogue with hospital workers and their representatives. We're talking about the best way to get things done. I understand that some of the people, Dr. Katz has spoken to this, some of the folks who have been closest to the challenge feel, for a variety of reasons, they made it through, they don't need vaccination. I think it's obviously objectively true that people do need vaccination, even if they did make it through. We've got to find a way to get that done. So those conversations are going on right now, and I'm very hopeful we're going to find a resolution. Go ahead, Nolan.
So what does that resolution look like to you? And if I just might sort of follow up on sort of the thread of this, if doctors remain hesitant because they made it through it, and many of us have made it through it, whether or not we've gotten shots or not gotten shots, what is the ceiling for vaccination in the city then?
I'm sorry, when you say the ceiling, how do you mean?
Yeah, so the ceiling is do you guys have a best guess for what the best outcome looks like sans a mandate? What percentage of the population you expect to ultimately agree to get it without a mandate?
All right, I'll give you my overview real quick, and then Dr. Choksi can give you something more erudite. But look, I don't think that answer is available now for a very simple reason. COVID has been an ever-changing story. And right now, so again, you've got 4.8 million people as of today who have come forward, gotten vaccinated. 4.8 million. That number grows daily. I think people are going to be thinking more, seeing the Delta variant, seeing the impact. You're going to see a lot of people who have been a little bit slow, a little bit hesitant, now feeling more urgency. You've heard Dr. Choksi and Dr. Katz talk about their own patients, and they both see patients still who get to that moment like, okay, now it's time. 150 million people have had the vaccination here in this country. I think that's a huge reassurance to a lot of people that wasn't there in the beginning. So I don't think there's your question is an earnest and important question, but I don't think there's like an artificial ceiling. I think you're going to see a lot of people think and then think again. A lot of people who may have been originally resistant get more open. We've got, to begin with, right this minute, hundreds of thousands more people we could vaccinate today who I think are ready. We've just got to make that connection, and then we go from there. I think the other big X factors are kids. First, the ones who are qualified, I think you're going to see a surge of vaccinations before school begins. And second, we've got kids from birth to 11 who are going to be able to be vaccinated at some point, possibly even this year. That's going to open up a whole new world for us, hundreds of thousands of more New Yorkers who can be vaccinated. So I think we got a lot to work with. Dr. Choksi, you want to add?
Yes, sir. Thank you. And look, Nolan, here are the facts as I see them. Over 96% of doctors across the United States have gotten vaccinated. We know this from good national data that's being tracked. On the other hand, over 98% of people who have been hospitalized or died as a result of COVID-19 this year in New York City are not fully vaccinated. So the choice is clear, particularly doctors, because we have studied the science, we've seen the suffering that COVID-19 can cause. That is the motivation with respect to getting vaccinated. And our job, all of the efforts that you've heard about, is to extend that protection to as many people as possible. So I agree with the mayor that our goal is to push the number as high as it possibly can go, because that means that more New Yorkers will be protected.
Thank you. Go ahead.
The next is Samantha Liebman from 1010 Wins.
Hi, Mr. Mayor. How are you this morning?
Good, Samantha. How you been?
Good, thank you. So I actually have a friend who works for HHC, and she is just not convinced about getting the vaccine. She listens to TikTok for her information. I mean, is there, there's some people, she's not a frontline worker. So is there an effort to maybe reach out to some of the workers who are not frontline workers to try to educate them and get them the right information?
Yes, absolutely. And, Dr. Katz isn't here to speak about those specific efforts, but Dr. Choksi, I'm sure, can speak about our ongoing efforts to reach folks who work in the healthcare field. Look, Samantha, you raise a really good point. There's folks who get information from all over and sometimes listen to a voice that might be very informed or might not be. We just have to keep pounding away, getting the best information to people, having a conversation. A lot of people need a conversation, not just have information like sent at them, but to really sit in a room and talk to someone, which is what we're trying to do more and more, particularly someone they know and respect. And that really makes a difference. We are going to win the battle against COVID literally one New Yorker at a time, but we're committed to doing that. Dr. Choksi, you want to speak about ways of educating folks who work in the healthcare field, including folks who work in the offices and clinics and hospitals, et cetera?
Certainly, sir. Thank you. And just building off of what you described, the approach is very similar to the one that I take, that many clinicians take in the exam room. It starts with listening to people, understanding their values, their preferences, their prior experiences with the healthcare system, which in too many cases has been negative and colors their whether or not they want to accept an intervention, a treatment. But it goes from listening to those one-on-one conversations that the mayor has described. And sometimes these have to occur over time. That's why we've spent the last several months really facilitating, lifting up people who can serve as ambassadors, or I know at health and hospitals that are called vaccine champions, people who can work through those iterative conversations to get to, people changing their minds with respect to vaccination. Ultimately, people have to find their own reasons. But there are so many reasons to protect oneself, to protect your loved ones, particularly people who can't get vaccinated because they're not eligible yet, like younger children. And in the healthcare field, obviously, it's about protecting one's patients as well. So we are seeing each day more and more people choosing to get vaccinated. As the mayor has said, the Delta variant means that there is even greater motivation to do that. And healthcare workers in many ways have been at the vanguard of this, but we have more work to do there. And the methods that I described will help us continue to achieve progress with respect to healthcare workers.
Thank you very much. Go ahead, Samantha.
So my other question is about this 4-year-old that was hit by a dirt bike yesterday. You know, the NYPD said they were cracking down on dirt bikes and ATVs, and in the council there is a proposal to increase fines. What else can be done to curb the use of illegal ATVs and dirt bikes? And mind you, this wasn't on a street, but rather in a parking lot, but still a 4-year-old is in critical condition.
It's a real serious issue, and you know, my heart goes out as a parent to that family, and we're hoping and praying for the best for that 4-year-old. Samantha, look, this is something that does not belong in New York City. It's the law, but it's also common sense. They just don't belong in New York City. NYPD has been very aggressive. Years ago, they confiscated a huge number of them and crushed them to make a point. They did that again a few months ago. They'll keep doing that. We need community members to help us find where they're being kept so we can get them, seize them. If one's out there, it's immediately illegal. It's just not allowed in New York City. And we will destroy them, literally, and send a message to people. I do agree with increasing the fines, too. I think people just need to understand there's going to be lots of consequences here. So I would absolutely support efforts to increase the fines. I think if we keep doing all those things, it's going to make a real difference.
We have time for 2 more for today. The next is Reuven Blau from the city.
Hi, Mr. Mayor. Thanks for taking my question.
How you doing, Reuven?
Good. How are you?
Good, man.
So 89 NYCHA playgrounds, more than 1 out of 10 citywide, are currently closed to the public because they're just unsafe. And we actually showed an expert some pictures of some of the ones that are actually still open. And he suggested that they're so badly dated and in bad shape that they should literally just be buried at sea. And also many of the spots that have been closed just don't even have public deadlines for completion. So my question is that when you ran for office, you pledged to close the Tale of Two Cities gap, but the playground issue at NYCHA has actually just gotten worse since you've been in office. Can you talk about that a little bit?
It's a real important issue. I'm glad you raised it, and I thank you for raising it. The bottom line is we got to do better. NYCHA's got to do better. Look, we all understand that during the year plus of COVID, a lot got put on hold. We understand that. There was a lot of work that would have happened otherwise that really would have helped that had to wait because we had to freeze a huge number of projects. But the bottom line is we need these playgrounds fixed. We've made a huge amount of investments through our Parks Department in communities that didn't get their fair share. So talk about addressing the Tale of Two Cities. We had a whole equity vision for parks, which led to a lot of money going where it was needed most and providing much better parks in communities that need it. But we got to do that in NYCHA too. Obviously, in recent weeks, you've seen the new basketball courts that have been unveiled in NYCHA developments. It's been a great effort working with the NYPD and charitable foundations. But we got to just keep doing more. So I'm glad you raised the playgrounds. I'm going to be following up at NYCHA. We need a systematic effort to make them good, make them positive for our kids. And we need a plan, a timeline, the whole 9 yards. A lot of improvements have happened in NYCHA on the most urgent issues. Obviously, the health and safety issues in the buildings have been where we've had to put our number one focus. NYCHA's proven that when you give them resources, they can make something happen. But we got to get this to happen now. Go ahead, Reuben.
Just following up on that, you talk about a plan. What would that plan look like? How soon would you put something out? And also, federal guidelines indicate that any playground that is dated beyond 1991 needs to be just totally revamped because the structures are unsafe. Are you willing to say now that any playground that NYCHA has that's past 1991 needs to be just totally overhauled?
It's a fair question, but I need to get all the facts from NYCHA, including about the federal law. And what I want is a plan that says, okay, here are the playgrounds that need work, here's the timeline, here's the resources and how we'll apply them. I want to make sure in our time here, in these next months, that we nail down a plan to address this issue once and for all.
The last question for today goes to Andrew Siff from WNBC.
Mayor, good morning, and everyone on the call. I hope you can hear me okay.
Hey, Andrew, how you doing today?
Good. I was wondering, what do you think of the American Association of Pediatrics strongly recommending masking for all students 2 and up this fall, and whether that comes across to people who just watched the parade you threw for frontline workers and Summer of New York and 4th of July and everything's over, and now they hear masks this fall. They hear Councilman Levine saying we want a mask mandate. Are New Yorkers getting 2 sets of messages here?
No, absolutely not. From day one, we said kids will wear masks in schools for the whole school year we just had. We said for months and months, kids will be wearing masks in the new school year. It's indoors. It's a lot of people together. Outdoors versus indoors, Andrew, you've been covering this story nonstop. Night and day, as Dr. Choksi said, there is still going to be a focus on indoor settings where you need a mask, schools, hospitals, various settings that just make sense and always have. So no, there's no contradiction there at all. Go ahead, Andrew.
On the issue of we know that this has been characterized as a pandemic of the unvaccinated at this point, but I wonder the degree to which, and maybe Dr. Choksi can address this, how closely are we watching the so-called breakthrough cases, and are we seeing an uptick in the number of fully vaccinated people who are testing positive?
As I turn to Dr. Choksi, because this question has been a very fair question, it's been asked a number of times, and Dr. Choksi and other healthcare leaders have said consistently, no, we're not seeing a major problem there at all. We're seeing a humongous problem with unvaccinated people. Dr. Choksi.
Thank you, Mr. Mayor. And that's right. The Delta variant, as we've said, presents the greatest risk for people who are unvaccinated. We do know from data around the world and in the United States to some degree that there is a slightly higher rate of breakthrough infections associated with the Delta variant as well. However, it's very important to distinguish breakthrough infections from breakthrough disease. The outcomes that we most care about, particularly hospitalization and death, the evidence thus far, the science indicates that all of the authorized vaccines that are currently in use in the United States continue to offer strong protection, not just against the Delta variant, but all of the variants that are currently circulating in New York City.
Yeah, and that's the bottom line, Andrew, and as we conclude today, the vaccine, beyond our wildest dreams, has had a profound impact, saving lives, keeping people from the worst impacts. If you're vaccinated, you are safer, period. If you're not vaccinated, you are vulnerable. The breakthrough cases have been few, but also, as Dr. Choksi said, with minimal impact. This is as clear as it could be. Bottom line, anyone out there, if you're not yet vaccinated, or anyone in your life is not yet vaccinated, we need you to do this now. It is free, it is everywhere. Get vaccinated and help us move forward. Thank you, everybody.